very good evening to all our viewers. Thanks for joining us here on this Sunday edition of the Urban Debate. I'm Afrida Rahman Ali. We're looking at two big updates at this point. We just heard the Chief Minister of Maharashtra making an announcement that all religious and public gatherings, including political gatherings, are banned in the state of Maharashtra in view of the rising number of COVID cases. Remember, Maharashtra, one of the biggest contributors to the national tally in terms of the COVID cases. The other update coming from the AIIMS director Randeep Guleria, who has made it clear that it is not prudent for a country like ours to depend on herd immunity. That also emphasizes in that sense the importance of the vaccination process in our country. Mr. Guleria says because of the disparities in the COVID strain, one cannot hope that herd immunity will be the solution for a country like us. Two primary aspects we are looking at. One, people lowering the guard. Fatigue element has set in with COVID. Many believe that there are people who are behaving as if coronavirus is over. Second aspect, the snail pace at which vaccination process is moving at the moment. For a population of 138 crores, we have just about crossed vaccinating 1 crore health workers. Is that good enough? At this rate, can we beat the invisible enemy? Some important pointers, viewers, in terms of the active cases. Look at the figures we are talking about and why Kerala and Maharashtra continue to be the biggest culprits. Active cases in Kerala stand at 58,609. Active cases in Maharashtra, 48,439. It is true that this is not the only parameter. There are issues like fatality rate, the transmission rate, the doubling rate, all of that assumes significance. But this is a fair enough understanding that it gives us on the states which are contributing to the national figures. 5-step action plan now being devised by the center. It's a guideline given to the worst affected states to increase testing. And by testing, the center talks about RT-PCR testing. Antigen tests are often not conclusive. RT-PCR testing to be made mandatory for all negative antigen tests. That is one strategy the government is talking about. And also, of course, a refocus on strict surveillance of the affected areas, monitoring of mutant strains, and also, of course, focus on clinical management in areas with high mortality. These are the 5 points the government has now advised the states to look at, and of course, like I pointed out earlier, to pace up vaccination. This is a huge area of concern now. I'm going to introduce my guests this evening. Dr. S.K. Sareen, Director from the Institute of Liver and Biliary Sciences. Good afternoon, Dr. Sareen. Sujata Rao, former Health Secretary, also joining us. Very good evening, in fact. Good evening, Ms. Rao and Dr. Sareen. Also, Dr. Anoop Amarnath, Chairman of the Geriatric Medicine Manipal Hospitals, and who's also a member of the Critical Care Support Unit in the government of Karnataka. Thank you so much, all of you, for joining us here. I want to begin with the question that is right now staring at our faces in terms of the quantum of the problem, the severity of the problem. Opinion is divided, viewers, on whether lockdown is the best course forward, whether it should be the first line of defense or whether it should be the last resort. Medical community is also divided on this. So let me first address this question to the doctors on the panel. Dr. S.K. Sareen, where do you stand on this? Is it in the very nature of the pandemic to have these little spikes here and there even after you notice a slowdown? Are there enough reason to worry, or you feel that this is how the pandemic is going to taper out? There will be surges before it finally fades out.
Well, this is certainly a cause of worry. Whatever measures were taken in September, October were visible by January, because the surge of the festive season came up by November, and I think the country started seeing some decline in late December, January, and early February. But whatever has happened probably could be a warning, and I do hope it is wrong, but there is likelihood of a surge the way it is going up in at least few states in the country. So this may be part of the nature, because virus has to mutate to survive in the human body, but we also have to mutate. We also have to improvise every day our strategy to a higher and higher level. On the other hand, several states and maybe several areas, the mutation is in the negative. We have become lax So we have to actually up our antennae so that we can manage this probable surge. And if this is true, if the people from Maharashtra go to other places or other cities in Maharashtra, from Mumbai or in Kerala, there could be a possibility of a wider spread. The question whether a lockdown is the best approach, it probably never is. Lockdown is a phenomena where people are restrained, and after the lockdown is over, there is a further surge in the movement. I think a proper understanding, a very, very strict contact tracing, identification, increasing RT-PCR testing, but above all, I think the vaccination drive. India is the only country where you have all these vaccines available. We just need to see that we have a jab there. We have to overcome the vaccine hesitancy. We have to ensure, and as government has rightly said, 50 and above, we need to ensure that there are multiple more centers available for vaccination. We have just covered 1% of our population, and we need to cover 30 to 40% more of our population. I mean, 30 crore people. So we just need to back count how many we need to do. And according to my simple calculation, we have to step up 6 to 7 times more of the current rate of vaccination to be able to cover the population at risk. Therefore, multifaceted strategies are required.
Okay.
Don't bring your
right.
levels down and increase your vaccination.
Yes, we will discuss the vaccination part again during the course of the conversation. But let's first thrash out the issue of the lockdown, and I want the views of the other panelists as well on this. Sujata Rao, you were former health secretary in the government of India. In terms of the strategy that the government is adopting now, do you agree with Dr. Serene that lockdown is not the first line of defense? There is a view coming in also that feels like Mr. Vijay Wadatiwar, who is the State Relief and Rehabilitation Minister in Maharashtra, says lockdown is the way forward because as an immediate measure, when you are in a situation like this, how do you prevent the public gatherings? How do you prevent people from spreading the virus? As an immediate measure, this is how the government can control it. Now, where do you stand on this issue of, because we are looking at a lockdown already imposed in one district of Maharashtra. Amravati is going into a 7-day complete lockdown after the weekend lockdown gets over.
Look, I have been consistently opposed to this concept of lockdown as a public health measure to contain and arrest disease transmission. But it has been found to be effective in some places. But if you look at our own data, March, April, May, we had the most rigorous lockdown. But what happened after that? We had such a huge peak of the infection surge all over the country. That was in August, September, October, and so on. So, lockdown only helps you to buy time to prepare yourself. It postpones the eventuality of a surge that's taking place. The key, in fact, US research has also demonstratively shown, that CDC, that wearing a mask and behavior change towards that has a far more lasting contribution to checking disease transmission than lockdowns have. So I really think, yes, you can regulate human behavior. Amravati can certainly keep a control over people going in and out, keep control over movements. But I really don't think that lockdown is the answer. You have to do much more on bringing in individual behavior change. And the mantra is very simple. Wear a mask, don't go into crowds, and also, keep a distance. And that can be regulated. Population movements can be regulated the way we saw in Delhi when we had the games and, when there's pollution. Wasn't the traffic regulated to reduce pollution? So there are means and ways available, and I think those should be not lockdown.
Right. Dr. Anup Amarnath, what is your view on this? Given the propensity of the people in cultures that we live in, I mean, festivals are big here, events just become order of the day. In Mumbai, for instance, 1,305 buildings have been sealed now, and it was noticed that there were a lot of these house parties responsible that became super spreaders. So there is this culture of religious gatherings and festivals and events. Keeping that in mind, how exactly do you think, if we look at solutions and strategies, how exactly can the government control this? Because even on the part of the government, in terms of guarding sentiments, etc., we have noticed that there is a tendency to be lenient on certain aspects.
Overall, I feel that, as the other panelists rightly suggested, lockdown is probably only one weapon in our entire armamentarium against COVID. And I think we'll have to use that judiciously. And, the major advantage that you have with the lockdown is that it can buy time. But the question is, what after that? So I think that's something which we need to address rather than look at lockdown as a panacea. And I think the other modalities, active testing, identifying the acute cases, increasing the immunization, vaccination, I think these are far more effective. And the simplest things, as we discussed earlier, in terms of masking, distancing, and hand hygiene, I think those are something which we really need to give priority rather than just focusing on lockdown. It's just going to buy us time, and I don't think it's a panacea at all. And one of the things which we're doing in Karnataka with the critical care support unit is to look at the acute cases, across the 31 districts in Karnataka, identifying those acute cases and identifying the right modality of treatment and how soon we need to start treatment on these ones. I think that goes a long way in terms of reducing mortality and morbidity with COVID rather than just focusing on one. So I think it has to be a multimodal approach, which the government is rightly doing by increasing testing, increasing the vaccination, early identification, and having the critical care support units across so that the mortality is reduced. So to summarize, yes, I would clearly say lockdown is just one part of the entire armamentarium, definitely not a panacea.
Right, a multimodal approach, Dr. Amarnath, is what you're saying. Okay, I want to get in Dr. Sareen once again because, now let's focus on the process of vaccine, the vaccination process as well. One point, of course, all of us agree that the pace is rather slow at this point. But just for clarity, Dr. Sareen, is vaccination really the answer? Will we be able to keep up in terms of fighting the virus by ramping up vaccination alone? How does the vaccine really work in a scenario like, when we talk about giving the human body more antibodies to fight the infection, but can a person still get infected? Can a person still spread the virus after getting vaccinated?
You have a very important question, and I want to emphasize two sentences. One, development of a vaccine was a huge scientific achievement. But to me, a bigger scientific achievement, or maybe a public achievement, will be vaccinating all. I think that achievement, when we could develop a vaccine in 1 year, can we vaccinate all in 1 year? If that is our target, we have to remember, let's say we have an innovation. Innovation has to be diffused. People are still scared. The US surveys say that even in November, December, 60% of the people said we will get a vaccine, 40% never. And all efforts were made. In India, there is no such survey. How many people are willing to take? So first is vaccine takers and vaccine non-takers. Even if you increase the drive, vaccine non-takers will remain the big threat to us, because if they get infected, they may have a mutant virus, they may have a difficult virus for us to manage. Now let's go to the vaccine takers. The vaccine takers, many of them in different age groups are ready. All efforts are being made. The government and the policies are now quite standardized. I think vaccine certainly has to be given, at least the first shot. If it is given to larger proportion of patients, I would be very happy. At least they have some immunity. The advantage, it's not a panacea. Vaccine is not a treatment, it's a prevention. And all vaccines today, they are approved on this premise that if you have a vaccine, properly 2 dosages of current vaccines, you get antibodies. If you have adequate antibodies, if the virus comes, the infection may be milder. The person doesn't need to go to maybe hospital, may not be needed to go to ICU, but it prevents life loss. So we have to make sure that the vaccination is accepted. People must tell the success stories rather than stories of fear. I strongly urge all healthcare workers, all must 100% get vaccinated so that they become a role model for rest of the people.
Right. Before I go to Sujata Rao to understand whether the government's policy right now to have this staggered approach is good enough or whether we should open out now to the other categories, I wanted a quick opinion from Dr. Anup as well on this point. People have a lot of questions, doubts about the efficacy part, and only when the Pfizer comes in with 95% we should go for it. How do we dispel these doubts and fears? How do we make sure that the vaccine hesitancy is addressed? In your experience, what are the concerns?
I think one of the major things that we need to be doing in terms of achieving herd immunity or anything like that is to increase the vaccine acceptance. And positive reinforcement is the main thing that will achieve this vaccine acceptance. And this positive reinforcement will come from data, number two, success stories, and number three, when we dispel the myths about the vaccination. I think these are three very important things that we need to be doing to increase the vaccine acceptance. But most importantly, I think what we need to be doing is open it up so that more and more number of people, rather than having a one channel through which vaccination is given, I think it has to be opened up. And once that happens, and once you have a choice, once you have data, and then once you have success stories, I think that is where acceptability will improve. And more importantly, targeting the susceptible population, the geriatric population, the elderly, the more susceptible ones. I think they are the ones who need to get access to that. So access, choice, and data. I think these are the three things which will improve vaccine acceptance.
In terms of the status in our country, Bihar has had the maximum of 85% health workers covered with the first dose of vaccine. 12 states other than Bihar have had vaccination of over 75%. But then it's not all rosy because you have at least 7 states and union territories where less than 50% of the target of registered health workers have come for the dosage. Sujata Rao, there lies the question on, if with this pace, it's the snail pace that the vaccination process is moving, and with these kind of targets being underachieved, what is your suggestion to the government of India? How can we ramp up vaccination? How can we pace up the process?
I think I would love to advise the government of India to really, just really scale up. I mean, I'm sure they're also wanting to scale it up. It's not as if they're hesitant. But I'm not convinced about this sequencing of population groups. First doctors, then the nurses, then the frontline workers, then the railway workers, and then the 50, and then the comorbidities and so on. Instead, I would like that, a multi-pronged coverage of all these high-risk groups or more vulnerable groups in cases in places where there has been a high positivity, for example, Amravati, and you use every avenue that you have, public and private, to reach these people out as quickly as possible in a parallel fashion. So like in Hyderabad, I find their centers ready with 100 vaccines and the whole team of 6 people are sitting there and hardly 20 workers turn up. So that whole day is wasted. Instead, if only all of us who are all elderly around would have been vaccinated, nothing would have happened. You wouldn't have wasted a day. So, I think there have to be. Now, there's no point in, say, Mizoram, which hardly had 30 cases of COVID, having 100% vaccination coverage, and Amravati, which has a 10.5% positivity rate, having only 2% coverage. I mean, I'm just taking wild examples just to make a point. So I think it's very critical that we identify the high target groups and high COVID in affected areas to give a multi-pronged attack where even private sector is quickly roped in, and then do the usual program that we're doing in the lesser vulnerable places and people, So that would be my approach, that you have a multi-pronged strategy.
A multi-pronged strategy, and of course a rethink is perhaps necessary at this stage. Dr. S.K. Sareen, Sujata Rao and Dr. Anup Amarnath, thanks so much for joining us. These are important observations that have been made today because we are looking at these two important aspects. One, what the government can do to enforce discipline. Can it do better surveillance? Can it do better testing and tracing? Is the government also being lax in these aspects? And then, of course, the onus lies on the citizen to maintain the COVID discipline, because we have noticed that the recklessness of a few people have cost the health and jeopardized the health of many others. That should not be allowed to happen. Thanks very much for joining us on this conversation.